You can see that it's all very thickened and quite nasty looking, and when you open and close her mouth, you can actually see where her teeth are almost rubbing and catching on it. It's a bit scary, this, because right there is a nice big vein. In that post-operative period is when we could potentially start seizuring.
Nala, girl, come on. Good girl, come on.
Louisa's next patient is a clinic regular, 7-year-old Pomeranian Chihuahua cross Nala, owned by veterinary care assistant Becca.
Good girl. We've had Nala since she's a puppy. She has kind of been a problem dog. So we found out she was epileptic when she was about 1. She's had both of her patellas done. Then she had an ulcer in her eye. She had some teeth taken out, and then when she came round from some anaesthetic, she ran into a door and then knocked a few out as well. So she's always in here. We walk through the door and everyone knows who Nala is, yeah. But we love her, my sister and me. This is like our life, so we'll do anything for her.
But this isn't a social visit. Accident and illness-prone little Nala has a new problem.
We found a little mass in the side of her mouth. It wasn't bothering her at first, but it has kind of grew. She kind of chews on it. So hopefully Louise can kind of either remove it or stop it from growing.
Hello, Nala.
Hello.
Hello. Sorry. So
Yeah, so there's a small one on that side and then there's a lot larger one on that one.
So you can see it poking around the corner there. Nala has a condition called chronic granuloma, but it's also known as a gum chewer syndrome, where she just catches the tissue around her tongue every time she chews.
Yeah.
And it gets bigger and more inflamed, and then it's this perpetuating cycle where every time she eats, she chews it, and then it gets bigger and inflamed, and then because it's in her mouth, it can get infected. So we will have her under anaesthetic, and then under anaesthetic, I'll be able to have a much better check over, because naturally she doesn't really like me looking at her mouth when she's awake. It's quite hard to examine the inside of anybody's mouth, so the only way that I can do this properly is with Nala fast asleep, under anaesthetic, where I can open and close her mouth and do a little bit of prodding and poking to see what we're looking for. This gum chewer syndrome, do you think it's got worse?
It depends on the day. So usually sometimes when I'll have a look, it's either red and ulcerated where she's been chewing it a lot, but when days when she's left it alone, you can see just a lump in there.
So the plan is that we will put her under anaesthetic and hopefully remove as much horribly thickened tissue as possible and stitch it back. But if I feel like the tissue has become too inflamed or infected, or I don't feel like it's the right thing to remove today, we'll wake her back up and make a surgical plan for another day. Yeah. Ready to induce? Yeah. You have a little snooze, Nala.
It's always nerve-wracking, obviously, when they're going under. She used to go in for operations and I'd sit in the waiting room and kind of cry, but you have total faith in like these guys that they know what they're doing.
Sorry, Nala.
For luck.
Right, are we ready to have a look at what we're dealing with?
With Nala now fully anaesthetised, Louisa can get a closer look at the damaged tissue inside the 7-year-old's mouth.
You can see that it's all very thickened and quite nasty looking, and when you open and close her mouth, you can actually see where her teeth are almost rubbing and catching on it, which is why it's called the gum chewer syndrome condition, because every time she closes her mouth, this piece of tissue is getting stuck in her mouth and it just gets worse and worse and worse. So the aim is that we try and cut that off, and she's got nothing to bite, and then hopefully it resolves. This lesion on the side of her tongue, it's now just really uncomfortable for her. She's starting to show signs of difficulty eating, and it's time to get this removed now.
But because Nala is epileptic, she's at greater risk under anaesthetic. So Louisa checks her tiny patient to make sure it's safe to start surgery.
Lovely. Just doing a heart check there, which is fine. Certain medications can, what we call, change the threshold to seizure, so it can put them at higher risk of seizuring, but we're going to avoid all those medications today.
Also worried how her much-loved pet will cope under anaesthetic is Louisa's workmate, Becca.
I'll probably be peeking through the window at times, but yeah, nervous about it, but being in here you kind of see how much they do care. I have full hope in Louisa. I trust her with her.
When it's a staff and a friend's dog, you do feel that little bit of extra pressure, but also it is quite nice that she trusts that we'll hopefully do a really good job and look after Nala. It is nerve-wracking when you're bringing your own pet in. I have operated on all of my pets and it can be quite hard to remain focused and objective, so I try and take off the load from the other team members when their pets are ill, because it's not nice making decisions on your own pet. It's actually quite upsetting. The tricky thing is how we're just going to keep her mouth open. I'll probably have to get someone to open her mouth for me to be able to do it.
Senior vet Alex arrives to provide the extra pair of hands needed to remove the troublesome growth from Nala's mouth.
If you hold the mouth open, it's perfect. Can you hold the bottom jaw for me?
Squashing it, isn't it?
Because the lingual vein is there. It's a bit scary, this, because right there is a nice big vein. You can see this big vein going down the side of the tongue, this sort of lingual vein. It's kind of off-putting whenever you see big vessels, because you spend half the time trying to make sure that you're avoiding it whilst also trying to do your job. I think it's just going to be steady, steady, steady. I do expect a little bit of bleeding, but hopefully nothing too dramatic.
Surgery to remove the irritating growth from Nala's tongue is proving tricky for Louisa, as she tries to cut close to a large vein.
I am trying to find a way to just kind of isolate the growth to avoid the big blood vessel. So the way I think I'm going to do it is just put some stay sutures on, and Alex to help me hold it up, and then we'll just slowly cut.
Louisa sews stitches into the 7-year-old's tongue, which will act as handles for Alex to elevate it.
It's like microsurgery in a tiny dog's mouth.
She can now safely access the tissue that needs to be cut off.
Yeah, that's the vessel there, so I feel like it's...
You can almost see through the tissue.
But it's just there. It's quite unnatural doing things in a mouth, and also Nala's quite small, so there's not that much space to deal with.
Size is also proving a problem for Louisa, with her much taller colleague.
I have to have the table lower, because I am smaller.
You could put the table up and get you a stool, and then that would...
Cheeky.
I'll just crouch down.
So you can see already that is the tissue that we're having to get rid of, and when it's stretched it doesn't look as thickened, but you can see this really sharp molar down here is the one that is basically getting almost stabbed into there every time she chews. So the aim is to try and get as much off as possible.
As long as you're happy near the
veins down there, isn't it?
Mm-hmm.
So I think that's it all out, isn't it?
Finally, the painful, damaged tissue that has distressed Nala for weeks is now gone.
I think that should be all right. I have got most of it off. It looks a bit gross, and I can see where it would be quite sore for Nala. So I want to make sure I don't leave anything extra that Nala could just restart chewing to make us go through all of this again. So I'm just taking a little bit extra just off the edges, just before I stitch it all back up. So we're just stitching up now, and then hopefully when she wakes up, she'll feel a lot better.
How's she getting on?
Oh, she's doing really well. So we've taken most of it, because I feel like it's come off nicely. So fingers crossed that's done the job and it makes it feel a bit nicer.
An anxious Becca has dropped by to see how the little dog she's raised from a puppy has responded to surgery.
Yeah, I'm quite pleased with that. I think that should be okay now. Right, and we just wake her up.
But because Nala suffers from epilepsy, waking her up is a perilous procedure in itself.
Recovery is quite important for any pet, but particularly those with epilepsy, because in that post-operative period is when we could potentially start seizuring. What we'll do now is just turn the lights off, so when she wakes up she's not, being stimulated too fast, too quick, because that can be what can trigger seizures. Oh, Nala. She's just waking up now.
Are you with us?
Nurse Becca is keeping an anxious vigil as her epileptic dog Nala slowly wakes from surgery on her tongue.
So we're dimming the lights, we're keeping it nice and calm, and that's why I've got Becca to come back in. So Nala's got a familiar face, and I'm sure that would have been perfect for Nala to see her mum wake her up.
It's always a relief when you see them opening their eyes and coming back round. Hello. Hey. She's like, I'm ready. Hey. She's like, I'm ready to go now. I'm happy with what Louisa's done. Yes, so.
Oh, Nala. It's not a good look, Nala.
Really not. Good girl. Come on.
Night, night, Nala.
Come on. Can we pop you back in here? There we go. Should we pop you back in there?
Becca and Louisa will continue to keep a close eye on their patient to make sure she doesn't have a seizure while recovering from her anaesthetic.
I'm here. Oh, good girl, hey.
That's a nice face to look up to, isn't it, you mummy?
I'm gonna stay in there. Good girl.
She's actually awake really quickly. So Becca feels relieved. I'm relieved it's the end of procedure, and then we'll just get her home. That's very, very cute. So you can see what Nala means to Becca. That's very cute. So we have to look after her. Extra VIP. Come on then. Come on then. Oh, you're a good girl, aren't you?
Before long, Nala is fully recovered and ready to go home.
Hello.
She's recovered really, really nicely, so we've not had any seizures. She doesn't need antibiotics or anything, just TLC at home. The plan for Nala is just to go home. No doubt she'll be spoiled, having lots of cuddles, and hopefully she wakes up tomorrow and she's absolutely normal. You certainly look better.
Yes, you do.
And yeah, she doesn't want that to grow back again, do we? You want to go home, don't you?
Yeah.
You want to go home.
Right, thank you very much. Off we go. Come on then.
Bye,
Let's
Nala.
go.
Bye.
Come on then. Let's go. Let's go. Good girl. Come on. Good girl. There we go. Good girl.
A week after surgery on her tongue, Nala is pain-free and eating normally. Becca and Louisa are continuing to carefully monitor the 7-year-old's progress. Hopefully the chewing disorder is now a thing of the past.
Good girl.